Symptoms of hepatic coma in case of chronic hepatic failure. First stage or pre-coma stage, where there is no accompanying disturbance in the patient's level of consciousness and in which there is changes in the patient personality, which include easily irritated, nervousness, behaving like children, extreme happiness or extreme sadness, frequent forgetfulness. Sleep disturbances in the patient, which include insomnia, sleeping during a day, and lack of sleep at night. And upon examining the patient, we will find hand tremors, a distinctive mouth odor, which is fetor hepaticus, and a change in the patient's voice with slow speech. Then coma stage. It may not be reached if the patient responds to treatment in the previous stage, and in coma stage, there is gradual deterioration in the patient consciousness, starting with patient's loss of sense of place and time and inability to recognize people or even identify themselves, followed by mild coma resembling normal sleep and then sleep coma. Treatment of hepatic coma in case of chronic hepatic failure. It begins at any stage of coma and includes prohibiting animal protein from the patient's diet, discontinuation of diuretics, use of lactulose syrup, administration of neomycin, performing repeated enemas while observing stool color, use antibiotics, performing endoscopy for the esophagus and stomach in case of blood in the stool or suspicion of bleeding varices where they are injected or ligated to stop the bleeding. And in cases of severe coma, the patient needs to enter intensive care. If the patient improves, they may be evaluated for a liver transplant from a living donor.